And welcome back to Dr. Noah's YouTube Health, and we have Linda back, and Linda's had some other type of health issues, so today we're going to talk about her thyroid. Tell us a little bit about what that was about. In fact, I had forgotten about that you were actually going in for the procedure because another health issue prevented that, so you allowed to try a natural approach, and tell us the story.
Exactly. Yeah, I was all set to start radioactive iodine
Well,
treatments.
tell them what kind of problem did you have, what were your symptoms, your difficulty, what was the diagnosis?
Well, I started having double vision, and so they sent me to an optometrist, and that person thought I had stigmatism, and then it turned out to be much more than a stigmatism. I had Graves' disease.
Right.
And once they sent me in for a thyroid test, they discovered that my TSH was a 0.005, which was extremely low, off the record.
Right.
So the only cure for that, they told me, was radioactive iodine treatments to kill the thyroid.
Right.
And then take thyroid medication the rest of my life, because they explained to me that Graves' disease does not reverse itself like some of the other thyroid problems.
Except, which we'll find out, it does.
Yes, exactly. So I started coming here, and like you said, because of another issue, we had to put that on hold and take care of that issue first, which took about 4 or 5 months. And during that time, you started treating my immune system. And
because once again, I don't treat Graves' disease. I just try to correct the body, get it balanced, and so working on the immune system was able to be what happened.
Well, after I followed your orders and changed my diet and took the supplements, I went back to the endocrinologist to see where my thyroid was at this time, so we could get ready for the radioactive iodine.
To his amazement,
my thyroid was perfectly balanced, no problem.
I think you had quoted that in the 35 years of his practice, he had never seen that.
He had nothing. He didn't know what to say. He just said, you know.
Well, that's what I remember. Maybe he didn't say that. But
I can do radioactive iodine treatments if you want me to, but I can't.
Why would he?
Recommend it.
Well, because your thyroid's healthy now.
Absolutely.
And like I said, in the textbook, it's irreversible.
Yeah, and that was 7 years ago.
Right, and it's still doing great.
Still, every time I go in, it's perfectly healthy.
Maybe they're hoping to go back. Hopefully not. Thanks, Linda.
Yeah, you're welcome.
Bye-bye.